see the patient, his or her facial expressions, and then we conclude what kind of station is that, right? So here, since we are doing online, you cannot see my expressions, but if you ask on the examination, like look of the patient, then I will be giving you details regarding it. Okay? So,
Okay.
okay, so your
Examination.
patient,
Okay.
yeah, examination. If you wants to see the patient, um, how is she or he sitting, or the facial expressions, or and anxious
Yes.
looking, I'll be telling you in the examination. Otherwise, you won't be knowing without saying me. So otherwise, in OSCE, in real life, they will be they will be sitting like forward and no eye contact and giving you very little information when talking. So
But in
yeah, that's
but
why you need to
psychiatry,
ask.
mostly the examination is not required now. So if we skip the examination,
Yeah,
like,
yeah, in OSCE it's not required in the psychiatric cases, but I'm telling you, since we are doing online, so you don't know what
oh,
expressions I'm making,
okay,
or
okay,
what
okay,
body language I have. So that's why. Yeah. Okay.
okay, okay, okay.
So your patient is Mrs. Lina. Just give me a second. I need to put the timer.
Okay.
Time starts now.
Hello, Miss Lena. My name is Dr. Sumera. Please tell me what brings you here today.
And doctor, actually, I'm really feeling constantly on the edge, and I'm very concerned about my son.
Mm-hmm. Okay. Please tell me more about it.
Doctor, actually, whenever he's at his school or his friend's house, I can't think about anything else. Like, I get this knot in my stomach and I keep imagining the worst.
Mm-hmm. Okay. So since how long you're having this kind of thinking issue?
Doctor, he's now 8 years.
Mm-hmm. No, no. Since how long you are having this
He's
kind of
going
thinking problem? Hello,
for Sumera.
doctor. I think my internet. Acha. Since I am asking, since how long you are having this kind of thinking problem? Hello, hello. Can you hear me? Can you all hear me?
Yes, yes, you are audible.
Hear you.
But I cannot
Okay,
hear
thank
Dr.
you.
Musarrat.
Okay,
I
I
think
We
no
got
one
your
is
have
timer.
can hear.
Now, can you hear me all? Because it was network, I guess.
yes, yes.
Yes, yes, yes. Now we can hear you.
Okay,
Okay.
thank you. I can start again because it's just 1.5 minutes. So
Yeah, sure,
if you
sure,
want to, yeah.
sure,
Okay.
sure. Yes. Just let me know when you when you will start.
Okay, your time starts again now.
Okay. Hello, Miss Lena. Mrs. Lena, my name is Dr. Sumera. Please tell me what brings you here today.
Doctor, I'm actually feeling constantly on the edge, and I'm really concerned about my 8-year-old son.
Okay, please tell me more about it.
Actually, doctor, whenever he's at a school or a friend's house, I can't think about anything else. Like, there's always a knot in my stomach, and I keep imagining the worst.
Okay. So since how long you are having these kind of thinking issues?
Actually, doctor, it was fine before, but since last 1 year now, I have this fear because I cannot let him go outside. I don't know why.
Okay. Tell me what happened 1 year back that make you think like that.
Mm. Actually, doctor, he had a minor accident. He fell off a climbing frame, and then we
Mm-hmm.
went to emergency. Even though he didn't get any serious injury, but I'm still scared.
Mm-hmm. Okay, sorry to hear about it. How was your son at that time? He's fine now?
Yeah, he's doing fine now.
Okay. So after that, you are having these kind of thoughts since after that.
Yes,
Okay.
yes,
So
doctor.
so how many kids you have?
I have this only one kid.
Only one kid. Okay. So tell me that you have a constant fear. Am I right?
Yes, yes, doctor.
Do you feel low mood also?
Sometimes, but doctor, I don't feel this. I get anxious every time he's going out.
Okay, I can understand it being a mother. It is a normal thing, but okay, we will discuss about it. Tell me that do you feel that you have lost interest in things which you used to do?
No, doctor.
Okay, and what about your sleep?
Sleep is fine.
And what about your appetite?
My appetite is fine also.
Okay, and do you feel there is any loss of concentration?
Sometimes, whenever he's outside, I just cannot do anything.
Mhm. So you feel anxiety only when your son is outside or when he is inside the house doing some task or when he went to school also?
Doctor, whenever we sleep in a different room, so at night I wake up to check on him mostly. So
Mhm.
even when at home sleeping, I'm scared.
Okay, so your sleep is also disturbed at night.
Yeah, I just wake up to check on him.
Okay, okay. Tell me, Miss Lena, that do you hear things which others don't hear?
No, doctor.
Do you see things which others don't see?
No, doctor.
Okay. Have you ever thought of harming yourself because of this? Or
No, doctor.
okay, that's very good. Okay. Tell me that do you have any other fears in your life
Mm,
from any object, from any animal, or from any
No, doctor.
person? Okay.
No, doctor.
Uh, okay. Tell me that do you have any long-standing illness?
No, doctor.
Are you taking any medication on long-term basis?
No, doctor.
In your family, is there anyone who has the symptoms of depression or
No,
say or
but my
symptoms or
mom used to be
similar
very
symptoms?
anxious.
Uh-huh.
Yes, doctor. My mother used to be very anxious about safety of the kids, and I feel I have the same thing like her.
Uh-huh. Okay. And like, has your mother, did your mother took any treatment or like for this or like she's fine?
No, she never had any treatment, but always whenever we're going out, she had the similar fear.
Okay. And tell me that do you feel any racing and pacing of heart?
Yes, doctor. Whenever I'm having fear, I have these palpitations, and also
Okay.
I sweat a lot, and I get
So
tearful.
you get tearful also. Okay. And tell me that what do you do for your living?
No, I'm a housewife.
Or housewife. Okay. Do you like with whom you live?
I live with my husband and just one child.
Okay. Is your husband supportive?
Yes, doctor, but we are fighting these days, and we have conflicts. He
Mm-hmm.
thinks that I'm overprotective.
Okay. Okay. So it's okay. We will discuss about it. Tell me that do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Like, do you take caffeine so much?
No, doctor.
Is there any stresses in your life?
No, doctor.
Okay. What is this thing is crossing over your mind right now?
Just doctor, I'm worried that I think I'm being overprotective, but the fear feels real. I cannot stop it.
Okay. And what about that? Which thing worrying you the most?
I'm scared I'm damaging him because my son is also getting annoyed with me. He's saying that mom is always worried, and that
Mm-hmm.
he will never be independent.
Mm-hmm. Yeah, it's your son is thinking okay in his own way, and we will discuss. And what are you
Mhm.
expecting from me today?
Doctor, I just like to help how to manage these thoughts and let him go to normal activities.
Sure, I will definitely do that. So this condition is definitely impacting you and your son's life, isn't it?
Yes, doctor.
So let's summarize. So you are Mrs. Lina. You told me that since last 1 month you are thinking a lot about your son, and whenever your son goes out, you have a constant fear, and you are you thinking that you are overprotected, and this thing is affecting your and your son's life, and you are tried. You want me to overcome, help you to overcome these thoughts.
Yes,
Okay,
doctor.
okay. So, Miss Lina, what I think is that you are having a kind of condition which we call it anxiety disorder. It is a kind of anxiety disorder. Okay, and since
Okay.
your son has a history of fall, and he is the only son, so you are scared of it after that incident.
Yes, doctor.
Okay. So for that, I would like to give you few suggestions. Is it okay with you?
Sure, doctor.
Basically, for that, you can do is that you try to do some relaxation exercises, try to do some deep breathing exercises. Can you do that?
Yes, doctor. I can try it at
Whenever
home.
your son is out, whenever you feel that these thoughts are coming, you try to do some relaxation exercises, breathing exercises. Okay, and try to I am also giving you a leaflet regarding this condition. You can read it, and I will also and I want to refer you to a psychologist for the talking therapy, which we call the CBT. It will really help you,
Mhm.
and what the psychologist will do, they will take out the negative thoughts from your mind, and put the try to put the positive ones. We can try this therapy for
Mhm.
about 3 months. Okay, and there is one medication also, tablet sertraline 50 milligrams, which we can give you, and you have to take this medication. Once you will feel good, you have to continue this medication for about 6 months. Are you getting me?
Okay, so I'm starting this medication now.
No, first we will start with the CBT, okay, talking therapy,
Okay.
and I hope with a few
Mhm.
sessions, after few sessions, you will feel good. We will try for this 3 months. If after 3 months you will not feel good, then we can try medication. How
Mhm.
about that?
Okay. That's fine, doctor.
Okay, that's good. And can you bring your son and your husband next time? I will also like to talk to them regarding your condition. Is it okay if you feel fine then?
Sure, doctor.
And one more thing is that try to improve your sleep, try to eat healthy, and try to do daily physical activity at least 30 minutes. And if you ever feel that you are having thoughts of suicidal ideation, then you come to me or come to emergency. Are you getting me?
Okay, doctor. Yes,
Okay.
doctor.
Do you have any other
Time's
anything
up.
else? My time's up. Yeah.
Mm.
Actually, the thing is that okay, I didn't get the
Yes, yes.
examination.
It's
Actually, the
fine.
thing
It's
is
fine. It's.
The thing is
Mm.
that I didn't get the exact word for that condition at the moment,
Mm.
and I that's why I use the word anxiety disorder. And
Okay.
yes, so
Okay.
that is why I think this is my some little
So,
um,
okay, I'll tell you something. Let's
yes.
go through overall your case, Dr. Sumara. It was nicely done, honestly, because these psychiatric cases, we don't need to actually hit the point, or you can say the perfect diagnosis cannot be made in psychiatric disorders. Okay, but in OSCE scenarios, if you are still just to be on the safe side, if you cannot make exact diagnosis, you can still say anxiety disorder. That's fine. Your case is safe. Okay? You didn't do any blunder like depression or she is having any post-traumatic stress disorder. You could have gone through that also. Okay? But No, you just said anxiety disorder, but because it falls into that. So it's separation anxiety, basically. Parent was worried about the child, and she was t telling you again and again that I'm just getting it mostly whenever he's at his school or at friend's house or when he's sleeping away from me, like in another room. So it's kind of separation anxiety. How we proceed from the history in general. First, we ask for the triggers, like what makes it. Like she already told you when he's going out or with in parties or with the friends. I'm getting so triggers were the child's separation. What what do you feel at the moment when he's not with you? The second question will be like this. Okay, doctor, I feel this palpitations and I have heart racing and pacing, sweating, and I cannot concentrate until he gets back. And we need to know what do you do when you feel this, okay? Because if her behavior is changing and it's affecting her husband and child also, so this is like considerable. In this condition, what she does, like repeatedly calls and texts the carer of the school, and she doesn't let him go to sleepovers or school trips. And so three things: what triggers it, what does she feel, and third, how does she cope the feeling, and how does it get better? Okay, whenever he gets back home, he gets better. So nature of anxiety should be ruled out. So it's specifically for the child alone when he's away from her. Secondly, the question was when did it started? There must be the event that started it since he's 8 years now and she's just presenting for the first time, so must be there any prequel for that. So there was a minor accident before that. That's why she's concerned about him. And it happens when I have seen people whose son got into accident or daughter got into accident, so they don't let them drive again. So there is a particular kind of fear that's generated after a quite proper event, or you can say just a random thing or usual. Okay, and after that, how does it affect her work if she's doing, she cannot do the daily routine she is doing at home, and the relationship she's having conflicts with the partner basically. So this is another drawback because it's affecting and impacting her life. Child is also affected by her symptoms I told you, and the red flags if she's not feeling low all the times, and if the low mood is there, if she says yes, I have low mood, but we need to ask, does it improve when your child gets back to home in case you are suspecting depression? But if she says no, even then when he's home, I'm still feeling the same. But then we can go on to the other direction, like it could be depression. But no, she gets better when the child is at home. Okay, and no suicidal thoughts or self-harm. Past medical history, she already has a strong family history of mother being anxious. Okay, and psychosocial. In every psychiatric cases, we are going to see psychosocial. Um, Why? Because in her family, like they are living alone. Okay, so they are the only family that are living alone, no nearby relatives. Firstly, secondly, high parenting expectations from culture and community. Okay, there might be a possibility, like especially in the South Asian countries, when their child gets hit or they get some injury, then the social or culture values hits in and they say that you are not a good mother, and what made you realize that you feel like this? And she might bring up a case like I'm not a good mother, and then the case will start like separation anxiety or any other anxiety. Okay, so psychosocial we need to know very well. Ice, you asked very well. Did you tell her that it's not being just overprotective, if the fear is real and it's causing you physical symptoms, and now it's affecting your and affecting your life and the relationship with the kid? So we will go for through a proper management plan, and you don't need to worry because it's a manageable condition. Okay, first we have to always reassure a psychiatric case. Okay, if there is a you know manageable or treatable condition. Otherwise, we need to proceed like any other case. Firstly, explain the difficulty, name that is separation anxiety. It mostly when you get separated from your child. Acknowledge it, validate her fear that it's real, scare, and it's causing your heart racing and other symptoms. So, firstly, I'm going to there are two things: lifestyle management and then the medication. And I believe that from lifestyle management, it will get better. So firstly, you'll tell CBT based psychological therapy. I'm referring you to the CBT, and they are experts team who can talk to you and who can make you relax regarding your condition. Like they will bring out negative thoughts as you told, okay? And they can also connect you to the mothers who are worried about their kids and how they coped up with them. Okay. Secondly, parenting support that discuss effect on the child's own anxiety. As you said that I want to see the child and the husband later. That was a good thing. And third, then we move on to the pharma, or you can say medication. SSRIs is the first line for any anxiety disorder. Emphasize that medication supports the therapy but does not replace it. Just give me a sec. Okay. So lastly, we can safety net the patient. We will advise if the mood drops significantly or she feels suicidal, as you said, then come back and we will review this kind of patient after 4 to 6 weeks at minimum. All right. Okay.
Okay.
Any
I
query in
forgot
this
to
case?
yeah, actually examination point that I forgot to, the examination was great. So like in anorexia nervosa case, if they say okay, this is out of topic, but
Yeah,
like
this is
examination is same like we do in other cases, the examination will be the same.
there are things where the examination is even if it's gray, it's necessary. Okay, gray doesn't mean that you shouldn't do. Gray is that do you know in this case you have to do an examination like in anorexia nervosa. Do you know you have to check the blood pressures and vitals and other things, BMI and overall physique because it's necessary in that case. All right. So side by side we need to know which case is important for examination, even though it's gray.
Okay, thank you.
Okay. Welcome. Okay. Next, Dr. Farheen. Was there for Dr.
Yes.
Farheen? Yes. So your patient, mm, Mr. Ahmad, 34-year-old male, came to discuss his problem with you. Please proceed with history management plan. Examination is there, okay?
Okay. Shall I start?
Just give me a minute. I put the time. The time starts now.
Good morning, Mr. Ahmed. I'm Dr. Faheen. How can I help you today?
Doctor, I'm just exhausted.
Okay, Mr. Ahmed, can you tell me more about it?
Doctor, I cannot see a way forward, and I just keep thinking everyone would be better off without me.
Mm-hmm. Okay, Mr. Ahmed, I can see that you look so sad. Can you share anything more?
Mm, Doctor, I don't know what to say.
Okay. Okay, so Mr. Ahmed, I just want to ask few more questions. Is that okay?
Okay, doctor.
Okay, so Mr. Ahmed, tell me, uh, what do you like? You tell me that you are feeling so low, right?
Yes, just doctor, just exhausted.
Exhausted. So since how many days you are facing this problem?
It's been now 6 to 8 months.
6 to 8 months. Okay. And is there any event going on just before you feel this type of symptoms?
No, doctor. Doctor, I just don't want to talk about it. I feel like you'll tell everything to everyone.
No, 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 Mr. Ahmed, don't worry about that. I am here with you, okay? And just don't worry. Like, if you can share each and everything with me, okay? It's always between you and me, right?
Okay, doctor.
Okay. So, can you tell me in detail?
Yes, doctor, I just feel low all the time. Since last 1 month, it's getting worse and worse. And even when I'm trying to cope up with this, I cannot. I just feel like this all the time.
Okay. Okay. So, Mr. Ahmed, don't worry about that. Mr. Ahmed, tell me about within the last 1 month, do you feel low mood all the time of the day?
Yes, doctor. All the
Mm-hmm.
time, every day.
Okay. And do you usually avoid going to other places?
Yes, doctor. Now I'm not meeting any of my friends.
Okay. So, Mr. Ahmed, tell me about your mood nowadays.
It's so bad. I just don't know what to do. I
Mhm.
think I shouldn't be alive.
Okay. And Mr. Ahmed, tell me about your appetite.
Doctor, I don't have any appetite.
Okay. Okay, Mr. Ahmed, uh, tell me about your. Is there any thoughts in your mind that you have ever tried to kill yourself or end your life?
Yes, doctor. Daily.
Mm-hmm. Daily. And so, did you make a plan? Any plan in your mind right now?
Doctor, I've thought few times to just take this all painkillers and all blood pressure medications at night.
Mm-hmm. So, when was the last time you did this?
Uh, I didn't do it, but I'm trying to. I'm making a plan, like I want to do it.
Okay. So, you want to just end your life or just hurt yourself?
Just, I don't know what, I just want to like feel relieved by taking this medication.
Mm-hmm. Okay. So, did you take these medicines or you are just planning to take it?
Doctor, one time I took it last
Mm-hmm.
6 months ago. Um,
Okay.
I took 22 tablets after my breakup, and I was
Oh,
admitted overnight.
okay. Okay. And then after that, did you visit to the psychologist or any psychiatrist for the treatment?
No, doctor.
Okay. So, Mr. Ahmed, tell me, are you taking any medicine on regular basis?
No, doctor.
Okay. Mr. Ahmed, did you make any will uh, after you attempt this, then did you make any will for this?
No, doctor. I
Okay.
didn't. I don't want to tell anyone.
Okay, okay. So, Mr. Ahmed, tell me, do you have any other long-standing illness?
No, doctor, but 10 years ago I had depression, so I took medication they have given me.
Mm-hmm.
At that time it improved me, but again now I don't want to live.
Okay. So, when was you last left your medicines?
It was 10 years ago. I took for 1 to 2 years, then I felt better. They gave me sertraline.
Okay, okay, okay. So, Mr. Ahmed, tell me, do you have any neck gland problem?
No, doctor.
Any type of kidney disease?
No, doctor.
Is any member of your family affected with the similar illness?
Mother had depression.
Mm-hmm. How she is now?
She's no more.
Okay, so sorry to hear about that, Mr. Ahmed. Mr. Ahmed, tell me, what do you do for living?
Doctor, I was working as an IT worker, but since last 1 month I'm just taking leave. and they are almost kicking me out of the job now.
Mm-hmm. So sorry to hear about that, Mr. Ahmed. We will discuss each and everything in detail. Okay, so Mr. Ahmed, are you married?
No, doctor.
Mm-hmm. And who do you live with?
I live alone. Alone.
Okay. Okay. So, Mr. Ahmed, is there anyone else, like in your friends or any relative that you are close with them?
Yes, doctor. I just am close with my father and a young niece.
Mm-hmm. A
I
young?
don't want
Sorry?
to destroy them. Niece.
Okay. Okay. So, where is your father? You didn't live with your father?
No, doctor. I don't live with him. He is in other state.
Okay. So you live in a in separate house alone, right?
Yes, doctor.
Okay. Okay. So, Mr. Ahmed, do you smoke?
No, doctor.
Do you take alcohol?
Yes, doctor. I'm taking 3 to 4 beers every evening.
Mm-hmm. And have you ever tried to quit it off, cut it down?
No, doctor.
Okay, we will discuss this thing. Okay, so Mr. Ahmed, tell me, is there any financial problems going on in your life?
Yes, doctor. I'm under debt, and since 4 months now, I cannot focus on anything, and it's building up because I'm living in a rented house, so that's why also.
Mm-hmm. I can understand. And Mr. Ahmed, you told me about your breakup. Anything that you want to tell me more about this, about your relationship?
Doctor just destroyed me. I'm not coping with this somehow.
Mm. Okay, so what happened? When did all these relationship problem started?
6 months ago.
6 months ago. Okay, so Mr. Ahmed, what's crossing your mind? What do you think?
Doctor, I'm definitely depressed again, but this time it feels worse.
Mm-hmm. I can understand and I can see that how sad you are. Mr. Ahmed, anything that worries you most?
I'm scared one night I'll just go through with it and I'll end myself.
Mm-hmm. And what do you expect from me?
I just need a proper help quickly, or I don't think so. Anything can help. Can anything help me, doctor?
Sure, sure. I will tell you each and everything. Okay, don't worry about that. Mr. Ahmed, tell me how far this thing impact your life?
Doctor, it impacted me in every way. I'm not meeting anyone, not going to job, drinking all day, just things like this.
Okay. Okay, so Mr. Ahmed, I just want to quickly summarize it. You told me that since 1 month you are feeling so low and you don't want to talk to anyone, and you have plans in your mind to end your life, and you are so worried about that as it badly affecting your your job and everything. Is there anything else you want to add?
No, doctor.
Okay. Okay. So, Mr. Ahmed, after taking history, I just suspecting that probably you have a condition which is called depression, and it is a severe type of the depression in which suicidal thoughts are present. Okay. So, right now, I'm just refer you immediately to the emergency department. Okay. They will do some of the investigations and they will give you medicines there, and they will do under observation. They will keep you. Is that okay?
Doctor, I just don't want any medication. Time's up.
Oh, okay.
Dr. Fareen, do you want another minute to finish the management?
Yeah.
Okay, the time starts now.
Okay, so Mr. Ahmed, I know that you are suffering a lot, but right now I cannot give you any medicine because the medicine which I give you, it will increase your anxiety level. It will increase your suicidal thoughts. So I cannot give you medicine right now. Okay, specialist will give you under observation. Is that okay? Are you getting my point?
I don't want to get admit, doctor. What will it help me?
Mr. Ahmed, just look, your life is so precious. One day you will come and thank to me that I will refer you to the specialist, okay? So when you will get better, then all the things will get better, okay? You will get your job, you will do whatever you want to do, okay? Are you
Doc-
getting my point?
Doctor, I don't think so. I can get back to normal life again.
No, 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 don't think like that. And I will also take on board mental health team. They will take you to the hospital. Okay, don't worry about that, Mr. Ahmed. You will get better with the time if you admit in the hospital and under the specialist care. Is that okay?
Hands up. Okay, doctor. Hands up. Okay. So, Dr. Farheen, nice try. Always this high suicidal risk or high, severe kind of depression. So, in this case, suicidal thoughts is in major depressive patient. If we start from the beginning again, we follow the core history, like core depressive symptoms since when, duration, mood, loss of interest, her sleep, like biologically, if he's waking up, sleep is very important in these cases. Sleep, early morning waking, or reduced appetite, or any weight loss. So here in this case, he was waking up early in the morning with reduced appetite, 5 kg weight loss, and feelings of fatigue and heaviness. So he was also having physical symptoms. Cognition, he wasn't able to concentrate at work, making mistakes or taking leaves. And one important question, worthlessness and guilt. Okay, and every time a patient of suicidal race or depression will come either by two ways. There could be many ways, but here in two ways. Firstly, he might say, "I'm exhausted and I don't feel my life like myself," or "I don't want to wake up tomorrow," or "I just want to end my life," directly. Or it can come like, "Doctor, I want medication for next 1 month." Okay, which medication? Sleeping pills, or I just want medication all in like one hand. Then you have to dig and dig like why he needs medication, because sometimes they will come and ask for prescription. They might take it and they already planned it and might be taking it home at night. So there are two things, two kind of scenarios we have to go through. In this case, it's straightforward. We will ask since when, then two screening question of depression, mood and loss of interest, then physical symptoms like sleep, appetite, then concentration and also worthlessness and guilt. Like, why does he feel like that? Okay, he feels like he's a failure as a son, and he's a failure as a human being, and just he cannot keep up with the relationship with his dad and also his girlfriend. Suicidal risk, you can say, ask, as you said, that have you had thoughts that life is not worth living? Yes, he's having daily thoughts. Then harming yourself. Yes, I want to take a loads of tablets. Any plans? Okay, so here in this case, always in suicidal, we will ask pre-attempt, attempt, and post-attempt. Okay, pre-attempt if he's been making plans or writing notes or um, making a proper plan pre-attempt. Okay, and but attempt includes how he did it, and if it was the medications, or if it was another way of killing himself. Then the post attempt comes, like what did you feel after you went through that? Did you feel better, or did you think that you are still alive? So we can know if the patient have still spirit of living or not. Okay. In this case, one important factor in every pre-attempt, attempt, and post-attempt, then you will come on to the protective factors, like with whom you feel better. Like you ask, is there anyone important in your life who is supporting you, or with whom you feels better. Okay, so here in this case, parents like father and young niece. So this one important protective factor we will take all along the management plan. Okay, there is one ray of hope, that is niece and fathers. We will take it in the management plan just to reinforce it. Other triggers or risk factors, like he is constantly on in debt. There must be any triggering factor that's causing him, giving him these thoughts. Taking alcohol, not taking care of himself. Okay. And in this patient also we will do psychosis screening, like, and do you hear any voices, or do you have, are you seeing any things that usually others don't see? Just one or two questions. Past medical history, already had depression 10 years ago, not taking any medication right now, family history positive. Again, psychosocial, very important. He's financially unstable, and he's not meeting anyone. He's worried about his niece and also his father. Ice was asked, and okay, here if you could have asked examination, I would have told you like regarding appearance, like poor eye contact, and speech is slow, low volume, mood is very depressed looking. Okay. Investigations, here we cannot do, we will just say that I am referring you to the emergency department. They will admit you, and how you will say it. And also say that at the end of the session, I will be doing your PHQ score 9. But in this case, it's a straightforward high risk, so this is severe depression. If you say it's a good thing, if you not say still it's fine. How you manage the patient. First, risk decision. First, we will see that patient is having active suicidal thoughts. So you won't let patient go out of the clinic or the GP setting, okay? Because he needs urgent mental health assessment. Immediate steps will be sending him to the emergency department, involve mental health team, and remove or reduce any means like don't give him access medication to pharmacy, and encourage him to bring if he has anything, any planned things at home, or not bring, just we will ask, like, is there anything already prepared at home? Or there might be any homicidal thoughts, so he might have done something at home that can destroy other people if he's living with the family. Okay, then treatment will be always under specialist care, and they will start him on the medication along with the psychological therapy like CBT, and also safety net. The patient, when you tell him that whenever you get a follow-up, in few days I'll be having a follow-up from you, and I need to see a good improvement in you, or you can say you will feel better after taking the medication. And this treatment, like you had depression 10 years ago and it was treatable, and you felt better for years now, and similarly you will feel better after taking this treatment also. So give him hope. Tell him that, do you want me to involve your father and niece? They can be a good support for you. You can feel better to see them, and it's okay. I'm also in connect with the social services. Very importantly, he's having financial restraints. Okay, so here you will give him hope. Don't worry, we have many social activists that we can connect you to, and they might help you financially. Okay, and just give him hope before sending him to the, and say it clearly if you feel worried about if you feel you are about to act on these thoughts, or if you overdose or go straight to emergency services. It's for the other people who are not currently having the suicidal thoughts. But in the high risk groups, we will just rapidly admit the patient. Okay, so in general, for every high risk suicidal case, pre-attempt, attempt, post-attempt factors, along with the protective factors, explain to the patient that this time you're going through a severe kind of depression. I understand. That's why I have to admit you, since you are having the thoughts of killing yourself, and it's a manageable condition. I am sending you to the emergency department. They might start you on CBT and antidepressants like sertraline or other medication. Meanwhile, I'm connecting your father and your niece, if you allow me, and I'm also connecting you to the social services, and I will be following you up after you get back from the treatment. That's all. Any query here?
Dr. Masala, sorry, my internet disconnected. What you told about the pre-attempt, post-attempt thing? Can you please just
Yes.
Please explain this one
Like
to me.
Sorry?
Yeah, can you please
Hello?
explain this attempt and attempt one?
Okay, so basically pre-attempt is how the patient made the plan. Okay, like how was his mood and what triggered it, and did he inform anyone or did he make any letter or any note to anyone? Okay, then attempt comes. Like when did he do it? What kind of plan or what kind of method he did? If he took medication, which medication, and if it's sleeping pills or antidepressant. So is he taking it on his own or he's getting it over the counter from where he's getting it? We need to know the source also. And what was the intention? Since he really wanted to end his life, or it was just to soothe himself for a while, like he wants to sleep for a day long. And also abuse with like alcohol abuse or okay, this was in the attempt. Then comes the post attempt. Post attempt, what was the thoughts when he went through that condition? Did you feel better, or do you regret doing it, or do you feel like it was a wasted attempt you want to do again? Okay, and what was the intention of it? Some people harm themselves because they feel it's a cry for help. So did you feel it was a cry for help, or you wanted it to really end? Okay. So these three things are a pre-attempt, attempt, and post-attempt. Then comes the protective factor. Like, is there any support in your life? Do you feel good with anyone? So this all needs to go all along. Okay. Dr. Ganga, we don't have to offer examination in the psychiatric cases because it will be visible from their body language and faces. You will do examination if you like anorexia nervosa or any domestic abuse. You need to see if there is any injury. Okay, but the examination will always be grave, not required. Okay, next case, uh, Dr. Aksa.
Yes, Dr. Musara.
All right, so your case, Mr. Rahul, 23 years old male, came to discuss his problem with you. Please proceed with history management plan. Examination is grave. Okay?
Okay.
Just give me a minute. Your time starts now.
Hello, Mr. Rahul. My name is Dr. Raksa. I'm one of your attending physicians. So, what brings you here today?
Doctor, I just can't cope with my social situations or when I'm speaking in groups.
Okay, Mr. Rahul, can you tell me more about this, please?
Yes, doctor, I really get anxious when I have to talk in front of other people. My heart races and I have this blush, like my face gets so much heated up, and I'm convinced that everyone is judging me.
Mm-hmm. Let me reassure you, Mr. Rahul, it will be remain confidential between you and me. You can share anything with me. Can you share me a little bit more about this?
Yes, doctor, it's just every time there are seminars or presentations or meeting new people, I get this heart
Mm-hmm.
racing, and I feel anxious.
Okay. Since how long you have been facing this?
Um, almost this is 8 months now.
Okay. So you have recurrent episodes of this?
Yes, doctor. Sorry, it's since my teenager.
Okay, since teenager. So you have also chest pain along with this?
No, doctor.
Any shortness of breath along with this?
No, doctor.
Anything that makes it aggravate?
Only this new social seminars or people.
Mm-hmm. And how did you get relief from these situations?
Just doctor, until I get back home, it stays the same with me.
Okay. So, Mr. Rahul, do you have any other problems? Do you have any feeling low mood nowadays?
No, doctor.
And do you lose any interest, which you are feeling interesting before?
No, doctor.
So, do you feel any worthlessness about yourself?
No, doctor. It's just in the
Uh,
social environment I cannot speak about myself.
And do you also notice any trembling in your hands or body?
Yes, doctor. Yes.
Are you being sensitive to the noises during these days?
No, doctor.
And how was your sleep?
Sleep is fine.
Okay, so do you have any weather preferences?
No, doctor.
Do you have any other long-term medical illness?
No, doctor.
Do you use any kind of medicines on daily basis?
No, doctor.
Do you have a similar kind of illnesses which runs in your family?
Just doctor. I am a shy guy, and it's likewise my siblings are shy also, and we all have this anxiety. Like sometimes we go out, we feel shy.
Mm-hmm. So, Mr. Rahul, what do you do?
I'm a student in the university.
Okay. And how's the thing at your university?
It's going fine, doctor. Just because of this situation, I have to come up in front of the class, and but sometimes I just avoid speaking, and I avoid parties and group events.
Mm-hmm. So, with whom you are living, Mr. Rahul?
I'm living in hostels with my friends.
And where's your family?
They are in other state.
So, how frequently you visit your home?
It's 3 to 4 months.
Okay, it's been difficult for you. So, Mr. Rahul, do you smoke?
No, doctor.
And do you having any drinking habit?
No, doctor.
Any party drugs?
No, doctor.
Do you gain weight or lost during these days?
Doctor, yes, I lost almost 1 to 2 kg in last 3 months because I'm
Mm-hmm.
avoiding kitchen when other people are cooking.
Mm-hmm. I can understand, Mr. Rahul. And what about your diet?
Doctor, I'm just taking snacks these days because
Okay,
I don't
so
need to cook.
Mr. Rahul, I would like to examine you. Is it okay for you?
Sure, doctor.
I would like to start from the general physical examination. I will start taking the vitals like blood pressure, temperature, and also checking the respiratory rate. And I would like to check your look for the anemia, jaundice, and any lumps and bumps with the body. And also, I would like to examine for your want to listen your heart sounds also, as you said that you have a racing of your heart also. So, can you come back to the chair, please? And Mr. Rahul, uh, what is crossing over in your mind?
Okay, on examination, patient is just anxious, shy, otherwise normal. I think,
Okay,
doctor, this is more than just shyness. I feel I have anxiety.
okay, definitely, maybe it could be. And what concern you have today?
Doctor, I'm scared I'll drop out or never get a job interview.
No, no, you will cope up from these situations also. And what were you expecting from me today?
Doctor, I'd like therapy to help me face these situations.
Mm-hmm. Mm-hmm. And how these things are going to affect your daily life?
Sorry?
How these situations going to affect your daily life?
Doctor, just in the university since it's my last year, I have to engage more and I cannot do like my studies properly.
Okay. So Rahul, by any chance, do you have any thinking about your self-harm?
No, doctor.
Okay, so Mr. Rahul, the data that I gathered from you, it shows that you are suffering from anxiety disorder. Do you know about this?
Yes, doctor, I read it online. It's kind of anxiety.
Yeah, so it's a kind of the anxiety disorder where you have a phobia, and because of this phobia, your heart getting start racing. That's why you having these symptoms. Otherwise, you don't have any physical illness right now, but all these things just because of your anxiety. Are you getting me?
Yes, doctor.
It's a benign condition, Mrs. Rao. Most of the people are suffering from these kind of phobias and anxiety disorders, and we can easily cope up with it. These things are totally manageable nowadays. And for shall we discuss the management plan for this together?
Sure, doctor.
First of all, I would like to tell you about try to make some friends and involve yourself with someone with whom you are feeling comfortable. And if is it possible, try to go to the nearby relatives. If is it possible if someone is living nearby you, and make connections. You can have a video calls with your family members daily, and with whom which you loved more. Okay, and they try to have some healthy food and vegetables that you said that you are snacking more nowadays. That's why you are getting you are losing your weight. Are you getting it, Mr. Rahul?
Yes, doctor.
And if we slowly if you will feel try to involve with your friend circles, and they try to make eye contact with them, then definitely you will feel good. I'm also going to refer you to the talking therapy specialist, where they will do some talking therapies, and which will help you to control your these emotions, and you will feel good after this. So is it okay with you?
Sure, doctor.
And I'm also giving a trial of these talking therapy sessions, which is 3 sessions per week, and for at least 3 months. You took these things. Otherwise, if you are not improving with these, then I'm going to add some medication for your moods. Are you getting me, Mr. Rahul?
Yes, doctor.
Meanwhile, I'm going to also offer you some of the basic investigations, to see that whether because of losing weight or because of the frequent snacking and you are not taking proper diet, you are having a maybe anemia. That I'm also offering you some complete blood profiles also. So is it okay? You can do for me this?
From today, okay, doctor.
And if you are feeling these things more, then your heart rate will be all more increased. And also, I would like, do you have any asthma or chest disease like this?
No, doctor.
So I'm going to also add the tablet Inderol that will help you to maintain your heartbeat. That you tell me that you are feeling racing and pacing of a heart. That will definitely help you. Okay, and you can take
Thanks.
a leaflet about. Okay,
Okay, you can finish the early flirt thing.
you can take a leaflet about your condition. That will definitely help you. And if you have an query, you can come back to me, or you can come back visit to the nearby hospital. Meanwhile, if you are ever thinking about self-harm, these thoughts making disturb you more, and is it going to affect your life, then you can come to the nearby hospital also.
Okay, doctor. All right. So, Dr. Aksa, yeah, firstly, in the psychiatric cases or in any other case, we need to ask only once, like, can you tell me more about it? And after that, close question will start. So there should be only one open-ended question. Firstly, what brings you here? Secondly, can you tell me more about it? And after that, we will start from the close-ended. Because sometimes a psychiatric patient will talk and talk a lot, then it will take a lot of your time. So once he told you that he's having the difficult times or and getting anxious in front of the class or other people or in the social gathering. So when there is a word social, so we just know that there's a social anxiety problem or social anxiety disorder, and he was having physical symptoms. So again, in any kind of anxiety disorder, we will first ask about the triggers or situations. Secondly, how do you feel or what do you feel at that moment? and what thoughts you have. Third, what do you do to cope with this? Okay, so there should be three things in general: triggers, what does he feel, and what does he do to cope with it. So his behavior was getting affected. He was avoiding speaking in class and in group events, and he was leaving rooms early just to stay disconnected. So onset and duration you asked, and it was since he was teens, and it's normal for the teenagers when they go in front of the bigger groups, they feel it like they cannot cope up with the anxiety. Some people become tearful, become shaky, some has palpitations. Okay, so it's quite normal. We will discuss about the management. How does it impacted his life? Since always it comes mostly in the university students. Either their academic is affected, like poor participation, getting failure results, affected grades, or socially, like very important in this case, we need to ask, do you have friends, or how much is your social circle, and is there anyone to support you? We can ask in any way. Okay, sometimes because people who are going through the social anxiety disorder, um, uh, they like withdraw from people, and that can change them into depression also. So just to know if they are coping up with talking to any friends or family. You asked about depression, suicidal, and substance abuse. In past medical, um, he was just shy, and the siblings were shy, otherwise normal. Psychosocial again, as you asked, where does he live? And he was avoiding kitchen because others were there, and also, in the concerns, he said that I don't know if I can get a job interview. So always address the patient concerns at the end. And yeah, Dr. Aksa, even if it's a patient female or male, in every case we need to say in presence of complete privacy and chaperone. If you don't say these two words, they might literally give the negative marking for any candidate. So this is just write it down or just say it in proper privacy and the in presence of chaperone. Okay. Then management plan explain the diagnosis to the patient that yes, you are going through a social anxiety disorder as you read on the internet, and it is quite manageable condition. You don't have to worry because many people go through this condition and it is treatable. So for that, I am referring you to the psychologist. There we have expert team, or you cannot, if you say just the layman language, since this kid is a university student, so you can use psychologist. Otherwise, for the people who doesn't understand or normal um, like housewife woman or who doesn't understand, so you can say to the mental health experts. Okay, they will educate you about its condition. And in this, we will have to say graded exposure task. One important word in social anxiety, we will say in the management plan, they start from the graded exposure task and behavioral therapy. Okay. Then this third is pharmacological. First, you will define what's going on. Second, lifestyle or CBT that I told. Third is more, for pharmacological medication. First line is Dr. Aksar, first line is SSRIs. Okay, if it doesn't get control on SSRIs, then for performance only anxiety or for the short-term treatment in front of the crowd, we can give beta blocker, as you said. But it's not the first line. First line will always be SSR, as in this condition also. How we safety net the patient, encourage him that this condition will not go on its own. You have to face your fear. And when you start coming up in front of the crowd, one time it gets better, the other time it gets better. So try to not escape the area or the crowd. Please try to change your behavior in that if that's possible for you, and don't try to run away from the places where you feel you're getting anxious. And you can tell the moment you are feeling palpitation or heart racing or things like that, you can take deep breaths Take 5 seconds deep breath, then stay for 4 seconds, then exhale it, like breathing techniques. Or you can just say, I'm giving you leaflet regarding self-help or breathing techniques when you're going through that similar condition. Okay. Or tell him for the safety net, like come back if you ever have suicidal plans or you withdraw with the people, or just plan a follow-up 4 to 6 weeks after. Okay. This is for this social anxiety. Next case, Dr. Maida.
Dr. Musarat, I have a question.
Yeah, yeah.
Can we can't use the word mental na, so you said that if we can't say the word psychologist, we can say mental
Mm,
health specialist. So mental, if we say mental, then the patient can get
yeah.
trigger and say that, doctor, am I mad? So can we use the
Okay.
yeah, the same word psychologist?
Sometimes, like in this kid, he's university going, so yeah, we can say
Yeah.
psychologist. Okay,
So
but if the patient here we have to say mental health. When we were preparing for our OSCE, we had the similar condition. Like if we tell him he's mental, he will be offended. Okay, first see how far is the patient. He's okay to hear the things. If he is aggressive and things like, don't use even mental. Tell him we have experts team. Okay, we have
mhm,
experts team. They will be talking to you. They will be reducing your stress level by talking and replacing your behavior techniques or introducing you to the new ideas that you would like. You always have to change your strategy according to the patient. Okay, because in this GP setting, you always have to twist the words according to the patient. Some patient might like it, some might not. That's why. So it's up to you.
Dr.
And
Musarat, can you
CBT
repeat?
sometimes you don't, y- yeah, sometimes you don't say CBT also. You will say talk therapy. They don't know about CBT. Repeat, doctor, what should I repeat?
You repeat. Can you repeat the management plan that you said that initially this is then this non-pharma like you said behavioral some behavioral therapies or
Yeah,
graded exposure.
yeah.
Hmm.
I'm referring to the expert team. They will educate you about your anxiety, and they will start giving you graded exposure task, and it will improve your behavior in general. They might give you new ideas that you would like. And in medication, if you don't feel better after 3 months of that talk therapy, we still have medications. You don't have to worry about that. We might start on sertraline, SSRIs, and secondly, even if that doesn't get better with that, we can give you performance only medications like beta blocker just before you're going for any performance. Okay, I hope it's clear.
So in this case, like this person is having some anxiety disorder. So initially we are going to try for CBT, and that's why I'm giving him beta blocker. So is it okay, or shall we add some
Mm,
SSRI
mm.
on the same time?
No, no, no. Here, this patient is quite normal. He is engaging with the people, not going on to the drug therapy, sorry, drug abuse, because mostly teenager guys go on the drugs also. So we just ignore, sorry, we just assess him regarding. Just give me a sec. Okay, yeah, just we assess him regarding his own condition. In this condition, he is not having moderate or severe. He's just mild. We can cope with him. So no medication by now. Just send him for the CBT and follow 4 to 6 weeks.
Thank you so much.
Okay, you're welcome. Next, Dr. Maida, your patient is
Yes.
uh,
Hello.
yes, yes, just give me a second. I'm bringing the case. Okay. Your patient is Mr. Shah, 41 years old male, came to discuss his problem with you. Please proceed with history. Management plan examination is correct.
Okay.
1 minute. Your time starts now.
Hi, good morning, Mr. Shah. I'm Dr. Maida here. How can I help you today?
Doctor, I'm feeling low all the time.
Okay, Mr. Shah. Can you tell me something more about it?
Doctor, since it started since my business went under, and I've been on edge and not sleeping, and I just keep going over everything in my head. So that's why, since 2 months is
Hmm.
going on.
Okay, Mr. Shah. Is it okay if I will ask you a few more questions to reach a proper diagnosis?
Sure, doctor.
Okay, Mr. Shah, you said that it's been 2 months that you are having low mood. Uh, s- am I right?
Yes, doctor.
Okay, can you tell me exactly what happened 2 months before? You told something regarding your business.
Doctor, my business collapsed actually. I lost my partners and I lost all of my business actually.
Hmm. Okay, Mr. Shah, I'm so sorry to hear about your loss. Um, uh, I'm here to help you. We will discuss each and everything. I will try maximum to help you in every possible way. Mr. Shah, may I know that do you? This is the only reason you are having low mood. Was you okay before that?
Yes, doctor, everything was fine, but since 2 months I cannot cope with this.
Okay. And is it like that since that time you are feeling low mood all the time or sometimes?
Doctor, sometimes whenever I'm thinking of it,
Hmm. Okay. And is it like that you've lost your interest in things which were you doing before?
no, doctor, I still enjoy some activities with my
Hmm.
children, but I get
Hmm.
tearful and sad whenever I have this thought of the business and future.
Hmm. Hmm. I can understand, Mr. Shah. It's quite natural having after such a loss. Mr. Shah, may I know that how about your energy level? Do you still feel energetic or you have very low energy or fatigue?
Yes, doctor, I feel fatigue most of the times because I cannot sleep properly.
Hmm.
So,
Hmm. Okay. May I know for how many hours you get a proper sleep?
doctor, 3 to 4 maximum.
Hmm. And do you wake up early in the morning?
Yes, doctor, with the thoughts I have.
Hmm. Okay. Does it disturb you by some nightmares?
No, doctor.
Okay. And does it comes like a flashback in your mind?
No, doctor.
Okay. Did you ever feel that life is worthless and you want to uh, end your life?
No, doctor.
Hmm. Did you ever try to harm yourself or your
All of
partner or
this.
anyone else?
Hmm.
Okay. Mr. Shah, do you have any other problem, any other same problem in past?
Uh, no, doctor, only since I got this business.
Hmm. Hmm. I can understand. And do you have any long-standing illness like gland problem, neck gland problem,
No, doctor.
and any kidney problem?
No, doctor.
Okay. Mr. Shah, may I know that do you have any family history of same type of problem
No, doctor.
or any depression in your family?
No, doctor.
Okay, Mr. Shah, may I know that to whom are you living?
Doctor, I'm living with my wife and my kids, two
Hmm.
young children.
Hmm. Okay. Hmm. Okay. So, is this situation affected your family life?
Yes, doctor, not family life, just I'm staying tense and my wife is seeing me not sleeping properly. I'm not going out into the community because I feel ashamed of myself sometimes.
Hmm. Okay. Mr. Shah, may I know that are you taking meals regularly, properly, or it's affected your appetite also?
Yes, doctor, my wife cooks for me as she sees me, I'm quite anxious. So she cooks me meal I'm taking, but
Hmm.
I'm taking less food now.
Okay. Did you notice any weight loss?
No, doctor.
Okay. Do you get enough time for walk and exercise?
No, doctor. I just stay at home.
Hmm. Do you know that how much is your body weight and height?
Uh, no, doctor, I didn't check, but it's normal.
Okay. Do you smoke?
No, doctor.
And how about alcohol intake?
No, I don't.
What about any party drugs or recreational drugs?
No, doctor.
Okay. Mr. Ahmed, may I know that what do you think that what's going on with you?
Doctor, I just think I'm just reacting badly to all this stress.
Hmm. Okay. And anything which concerns you most?
I'm worried I might slide into proper depression.
Hmm. Okay. And what do you think? How can I help you today?
Doctor, I just like some support or talking therapy or anything that
Hmm.
can get my better sleep.
Sure, sure. And as you said that it's affecting your life. So anything you want to add that if it is affecting some other way in your life?
Just doctor, I'm not the person I used to be before. It affected me a lot.
Hmm.
I
Yes, I
try
can
to be
understand.
happy with my kids, but still I get tearful
Hmm.
so many times.
I can understand your worries, Mr. Shah. I will tell you in detail. Mr. Shah, will you allow me to have a quick examination for you?
Sure, doctor.
I will sanitize my hand under complete privacy. I will do your general physical examination, your BP, pulse, temperature. Then I will examine your neck for any neck gland. I will ask you to swallow a sip of water to check your thyroid glands. I will ask you to stretch out your hands to see any tremors on your hand. I will auscultate your heart for any murmur, and I will check your lower limbs for any edema. So, Mr. Ahmed, I have examined you and I have taken all your history. Based upon your history and examination, which looks normal to me, looks like that you have been suffering from a condition which is called adjustment disorder. Are you aware of this term?
No, doctor.
Actually, this is a condition in which, due to any stress in life, someone is not able to cope that stress, and that's why these symptoms happen: depression, lethargy, low mood. And but luckily, these symptoms go away within 3 to 6 months with proper attention, cooperation, and with some medication, and sometimes only lifestyle modification. So, do you want to
Hmm.
hear about this treatment?
Yes, doctor. Yes, doctor.
Okay, Mr. Shah, I would like to tell you that as I understand that you have been suffering from this trauma in your life, so I will advise you a few things. I will give you a leaflet as well in which there are different remedies are written. You can search some websites which are written. You can go for your self help and read the material. If you want to discuss with me, I am here to help you. There are some techniques which are written in it. It's called breathing techniques, relaxation technique, deep breathing. Things are written, so you can practice of these exercise. You can do some yoga exercise, cycling, swimming, whatever you like
Hmm.
to make you calm. Okay, so you have to control your nerves. So does it make sense? Are you getting me?
Yes, doctor.
Okay, Mr. Shah, moreover, I would like to please emphasize that please take care of your sleep. It's very important to have a good sleep. Take care of sleep hygiene. Different methods are written in this leaflet how you can have a good sleep at night. Then take a proper diet. Take high protein diet, carbohydrates, and enough fruits and vegetables in your diet. Avoid constipation. Hydrate yourself. Is it okay, Mr. Ahmed? Can you do
Mm,
it?
yes, doctor.
Okay. Um, I would also advise to involve your family, especially your wife. Discuss with her. I hope that she will cooperate with you, and she will be a very good support for you to.
Time's up. Okay. Continue this last treatment.
I would. Okay, I would like to see you in 2 weeks. If you were not able to have like a proper like you will not able to cope with your symptoms, I would like to add a. I will send you to a psychotherapist, which is for a treatment. It's called cognitive behavior therapy. It's a talking therapy in which they will let you to talk. You will talk with them, and they will give you some other techniques to cope with the stresses, and they will give you some new advices that will be very much helpful for you. And in case
Okay.
it won't work, then the third thing which can we can it is called medicine, which is called SSRI. I will give you a tablet sertraline 50 milligram once a day. It will start its action in
Mm,
2 to 4 weeks, and you have to take it after your symptoms will resolve 6 months after that. Are you getting me, Mr. Ahmed?
yes, doctor. Time's up.
Sorry, Mr. Shah, are you getting me?
Yes. Yes, doctor.
Okay.
All right. Dr. Maida, nicely done. Um, Again, whenever there is a kind of disorder, anxiety or adjustment or any panic, etc., firstly, we need to see how long is the duration. Yes, this is adjustment disorder, and when the patient is telling you since 2 months and right after something bad happened, like business collapse, mostly you will see in adjustment disorder they are getting tearful. Okay, one word will be helping you a lot in this case because he's telling any patient telling you something major happened within 3 months of happening it he or she presented to you and what she is feeling tearful. I'm tearful and up and again one the fourth factor is they gets better or they enjoy when they are close to their close people. Like he's getting better by spending time enjoying with the kids. But again, he gets tearful when he thinks about it. So four things always in the adjustment disorder. Within 3 months of happening anything. Secondly, getting tearful after any major event. And fourth, they gets improved by enjoying the daily life or being close to the people. Again, the stressor, we need to know the symptoms mood, anxiety, sleep, appetite, function go hand in hand. Okay, everything. His functionality is disturbed since his business is collapsed. He's staying home, not going out mostly. But we can ask, as you asked in the management, to go for a walk or to cope up, to do the things that he likes. And what I liked about in your case, Dr. Maida, you reassured the patient at first, and this is very good opening line in your management plan. You said this is quite manageable condition, and as you said, sometimes it gets better with the lifestyle, and sometimes medication is needed. So, do you want to hear that? It was the gem line of your case. Okay. And again, when there is any kind of this disorder, screen for depression, low mood, loss of interest. If both yes, then you will go on the other. Anyways, appetite and sleep is always affected in psychiatric cases. Past medical history, none. Psychosocial, he is avoiding communicating because he feels ashamed. No suicidal thoughts. And since it's just an adjustment disorder, we will explain. This is an emotional or behavioral symptom that you're suffering, yet you're having after a response from that stressor of getting a business collapse. And reassure you that it goes with the lifestyle management and the medication within 3 to 6 months. Firstly, I'm referring you to the talk therapy. And if you say the talk therapy, it's better. Instead of saying I'm referring you to the psychotherapist, he will start you on the CBT, and CBT is therapy in talking therapy, it will take a lot of your time. Okay, we cannot exceed more than 10 minutes. And Dr. Maida, your case was 7 minutes of history. Then on 8th minute, you were doing examination. Only 2 minutes were remaining for the management plan, where we should just finish the examination up in the 5 minutes, in the first 5 minutes, and then 5 minutes should be of talking and talking and talking. Okay,
Yes, yes.
tell him for the practical help, like tell him since we need to ask about the financial always in every psychiatric case. Can they, is there someone to support them? Are they going through any financial restraints? Yes. So I'm also at, referring you to the or liaising you with the social services, and also sleep and symptom management. He asked for the concern in his sleep for his concern. Okay, so sleep hygiene should be discussed. We cannot forget the concern. Tell him that you just fix your wake time and bedtime routine. Don't go to your bed or don't lay all the time in bed until and unless you have to sleep. Avoid screens, avoid caffeine late nights. And if severe, then we can start you on any short-term hypnotics or short-term medication. Okay, and safety net and follow for the patient in 4 to 6 weeks. Again, tell him for the suicidal risk. And this is the next case. Is
Dr.
one
Musarat,
testimony. Who's
Dr. Musarat, I have a question. In this case, how can we differentiate between the depression and adjustment disorder? Hello? Hello?
so?
Dr. Musarat, can you hear me?
Yeah, I can hear you now. Can
Yeah.
you repeat?
In the previous case, the last case, how we are able to differentiate between depression and adjustment disorder?
In this case, Dr. Maida's case,
Yes.
depression is never within 2 months, is it? The symptoms should last more, at least 6 months or more
So
in
for depression,
depression.
for
And
depression,
secondly, yeah, at least 6 months. And at least two things should be there: low mood all the time and loss of interest in everything. Okay, here he was getting better while he's spending time with the kids. Okay, so in depression there will be a longer time frame because people try to cope with themselves and they avoid showing up in depression. But in adjustment, mostly patients coming tearful and getting sad and after a major life event, especially some business collapse or financial strain. But they are telling you that they feel better after spending time with children. So they didn't lose interest in their daily life.
And how can we differentiate it from post traumatic stress disorder? Is there any duration there also?
Post-traumatic, we will study in that post-traumatic stress disorder because there are flashbacks, nightmares, and avoiding the places or the situation that brought them to the PTSD.
Okay, mean
Three
flashback and nightmares are
points.
the main symptoms.
Yeah, flashbacks and
Okay.
nightmares are the screening here for PTSD. Okay. Okay, so last case, doctor, who is available? If, does anybody wants to do? Okay, or I should pick Dr. Tahreen, Dr. Ganga.
Yes, I can do.
Okay. So your patient is Mr. Rahul. Mr. Rahul has done. Okay, it's done. Just a minute.
Hello, Mr. Rahul.
No. Just give me a sec. Your case have changed. Mr. Jay, 31 years old male came to discuss his problem with you. Please proceed with history management plan. Examination is great, and your time starts now.
Hello, Mr. Rahul.
Hello, doctor.
I'm Dr. Ganga, your GP here today. How can I help you?
And doctor, just I'm avoiding going out.
Okay. Can you tell me more about this problem?
Yes, doctor, I've started getting these huge waves of anxiety when I'm in shops or in the train. Now I'm scared to even go anywhere by myself.
Okay. So can you tell me when did it start?
It started like 5 months ago. First time I was anxious when I was in the supermarket.
Okay. So can you describe me what happened at that moment when you go outside? What is happening to you?
And doctor, actually, I feel palpitation, this racing and pacing of heart and chest tightness. I feel dizzy and just don't want to stay there.
Okay. So is it happening frequently whenever you go out of house?
Um, yes, doctor, all the time. Now I've stopped going outside. I just feel safe at home.
Okay, you don't feel anything, you feel safe at home.
Yes, doctor.
Okay, do you feel like going afraid to places with the height or going to places with the closed room where you can't go out? Do you feel like fear of going to such places?
No, doctor, every time I leave my house, I feel I might die or something will happen to me. So I feel safe at staying at home.
Do you feel afraid of any animals, any people?
No, doctor, only where there is crowded places.
Okay, so can you tell me about your mood for the past few months?
My mood is fine. Just every time I have to go out, I get anxious, so I'm not going out.
Okay, so what about that activities you previously enjoyed? Are you still enjoying them?
Yes, doctor, I used to play games and still playing online games, and I enjoy it.
Okay, they are not affected. Good. So can you tell me whether you can hear what other people can't hear? Do you think you can hear what other people can't hear?
No, doctor.
And do you ever see things other people can't see?
No, doctor.
Okay. So have you ever felt like harming yourself or ending your life?
No, doctor.
Okay. So do you feel like worthless and helpless like ever? Do you
Um,
feel like
just doctor, not helpless, but like I am relying more on my partner because I cannot leave alone if I have to buy grocery. I call him, and then he takes me.
okay. So can you tell me what's your idea about this problem? Do you have any idea?
Doctor, I just feel it's a panic attack.
Okay. So what is the main worry now you are having?
I'm afraid that one day I'll collapse and no one will help me. I'm also scared that I'll become completely housebound.
Okay. So what is hoping are you what's your hope today for meeting me?
I want any treatment, doctor. Just I don't want to stay all the time because my friends are getting annoyed with me. They always have to bring me things at home. So
Okay.
anything to help me.
So how it is affecting your life, this problem? How it is affecting your life? Can you describe?
Doctor, I'm avoiding going out, and I stopped commuting to work by bus, and now I'm taking sick leaves, and I'm just not doing things like I used to.
Okay. Can you tell me about your social life? What do you do for a living?
I'm an IT worker, and I used to go to job at first, but now I'm staying home and doing work from home.
Okay. Are you married?
No, doctor.
Or you are not married? So who else at home now with you?
I live alone.
Okay. So what about your family members, your mother, father, and any siblings?
Yeah, they're in the other house, 2 kilometers away. I
Okay.
live alone.
Uh,
Mm.
who else are with you? Any friends, any relatives are having any connections with you?
Yes, doctor, my friends often visit me. My family also does.
Okay. So do you feel like separated from them now? Do you feel like
Uh,
that?
yes, doctor.
Okay. Can you tell me some personal things, Mr. Rahul?
Sure, doctor.
Can you tell me whether you smoke?
No, doctor.
Do you use alcohol?
Yes, doctor, I'm taking alcohol these days.
So how much? How frequently?
Like every 3 to 4 days, I take 1 to 2 pints.
Okay, everybody days 2 drinks. So any other use of any recreational drugs?
No, doctor.
Okay. So do you drive?
No, doctor.
Okay. Can you tell me whether you have if any family members in your family are having mental health disorders? Do you know anyone?
No,
Hello.
doctor. No, no family history.
Okay. So other than this problem, do you have any long-term illnesses as diabetes, hypertension?
No, no, doctor. No.
Okay. Are you taking any drugs? So
And Dr. Ganga, I'll pause the timer. I cannot hear you. Is it my network?
I can hear.
I cannot hear you clearly.
Can you
Hello.
hear me? Can you hear me now?
Yes, I do hear you now.
I
Okay,
can.
time started again. 3 minutes.
Okay. So I would like to examine you, Mr. Rahul. Uh, is it okay?
Yes, doctor.
I would like to check your blood pressure, pulse rate, do the general examination, and I would like to check your thyroid, and cardio, heart, and lungs. Is there any examination findings?
Okay. Patient is just anxious but oriented, otherwise normal examination.
Okay, thank you. Mr. Rahul, with the examination and your history, now I would like to summarize the problem. You are having fear of going out for past 6 months, and it's affecting your life and the day-to-day activities severely, and you are having features of anxiety in the examination. So my impression is that you are having a condition called social anxiety disorder. So, have you heard of such a thing?
Uh, no, doctor.
Okay, don't worry, I will help you. It is a type of anxiety disorder where you fear, you have an excessive worry about the condition. So, you are having excessive worry of going out and meeting people and going out to places outside your home. So, there are several methods of treatment. So, first one is lifestyle measures and psychotherapy, that is talking therapy like thing. And that second one is some drugs are available. First, let's try the uh, non-drug method. So, first, I would like to advise you to do some relaxation exercises, breathing exercises. Can you follow me for that one, please?
Yes, yes, doctor.
Yes. So I would like to also to take good eating habits, good healthy meals, and also to cut down on your alcohol. And I would like to also to advise you to take some physical activity and increase more exercises, and then good social connections with some friends. And there are some
Mhm.
groups as well. I will connect them with you. So then this talking therapy, I will refer you to the counselor, and
Answer.
he will do counseling. And if it is not responding, I will give you some drug called as sertraline. We will talk about that later.
Mhm.
Uh, Thank you very much. I will see you in 2 weeks.
Okay. Okay, doctor.
Thank you.
Thank you, Dr. Ganga. And yeah, was this social anxiety? You said it's a social anxiety. It's under the anxiety disorder, but what specifically make it social anxiety?
Because he's having fear of going out
Yeah,
outside his home.
yeah. So firstly, in your history, what's very good points that you ruled out psychosis, any specific phobias, like is he does he want going on to the heighted place or gets anxious when he's going to the heighted places? And you asked about the depression question. So almost you screened every kind of depressive disorder or anxiety disorder. But here in this case, mostly patient will come with one sentence. This case is basically for agoraphobia with panic attacks. And very slight difference from the social anxiety, but I'll tell you two sentences. Firstly, if the patient is saying, I am afraid of going into the crowd or crowd, I am trying to leave the crowded places, as the university student was telling, I am avoiding crowded places. If if reinforcement is more on the word crowded places, then this is social anxiety. Okay, but if the patient is telling you, I am afraid to even leave the house, like in this case, he doesn't even want to leave the house for his daily life activities, like he doesn't want to even do grocery alone, like every time he's leaving home, he cannot go on his own, so he is calling his friends. So this is very minor difference from social anxiety and from agoraphobia. ठीक है? ठीक है? Agoraphobia. So in this case, we will go like this patient is having a panic attack along with the agoraphobia. Why? Because he is having a particular fear of not leaving the house. Again, what do you feel when you leave the house? And how do you cope with that? He comes back home immediately. He doesn't want to stay out. Okay. So are you following, Dr. Ganga? Can you hear me?
Yes, but you told that he's not, there's no specific fear of going to places with closed doors and going to fights. Isn't that agoraphobia?
Yeah. No, no. Agoraphobia is the fear of leaving house.
Uh-huh. So
Okay.
social
So
anxiety
agoraphobia.
disorder, what is the difference?
No. Difference is the patient will tell you, I am going out of the house, but as soon as I go into the crowded places, I feel
Uh,
anxiety, palpitations, and I want to get away
it's like
from that place.
housebound
Okay.
in agoraphobia.
But
He's like housebound.
hello.
Is he like
Yeah.
housebound in
In
agoraphobia?
Yes, yes, housebound. So here
Okay.
in this patient, he was saying that I am not even leaving the house for my grocery even. Okay, he was calling the friend for the grocery items for someone to take him even from the house. And second line in agoraphobia, person will tell you that every time I'm going out of the house, I feel like I might die somewhere and no one will be able to help me out.
Okay.
Okay. Thirdly, social withdrawal, how he is enjoying his life. He is playing games and he's not feeling low mood. So it's not depression case, but he doesn't just want to leave house. Whatever he's doing, everyone is visiting him. He's fine. Just as soon as he leaves the or step out from the house, he's feeling the fear. So how we will say this case? It's agoraphobia with the panic attacks. Why panic attacks? Because as soon as he leave the house, he's getting the panic attack. Okay.
Yeah.
So if even if we just say agoraphobia, this will fine. We will explain the patient. Firstly, in the history, there are a few points I would like to say. First attack, like when he felt it for the first time, it was 5 months ago. You asked about the symptoms. Good thing you asked about the any other problem like neck gland and other. Duration of the symptoms should be asked, like for how long does it stay, and what do you do when it comes to you. He's avoiding, he's not going out, his work is affected, he doesn't go to grocery either. So in past medical, there's no major medical issues. Psychosocial, he has fear of losing the job. And also, yeah, one important thing in agoraphobia, mostly patient won't present you early. Patient doesn't even isn't able to even leave the home. So how is it sitting in front of you in the clinic? First point. So we will ask later with whom you came here. Because these kind of patient doesn't come on their own, we will ask who brought you here, or is there anyone who accompanied you? He came with the family member. Okay. And in the management explain, it's just avoidance of the places, and you feel more better at home. So for this, there are two lifestyle and medication management plans. So firstly, I'm referring you to the talk therapy. They will explain you um, uh, about your condition, also giving you breathing and relaxation techniques. Then they will start with the graded exposure again. Also pharmacological, if it doesn't get it within 3 months, we might start you on medication. We call it sertraline. And if it's affecting your sleep, then we can start you on short-term hypnotics. Otherwise, safety advice, safety net, like a return if you have any chest pain or even if you feel at rest, these symptoms or any suicidal ideation. So review is always in 4 to 6 weeks for every anxiety disorder. So I hope it's clear till now.
Yes,
Very
thank
minor
you very
line
much.
change.
I
Thank you
want
very
to
much.
ask
Thank
a
you.
question.
Thank you, Dr.
If the
Mother.
patient,
Yes,
if the
doctor.
university student went to the hostel and unable to adjust there, na, and having low mood and
Yes,
anxious and worried, then this we call this is the adjustment disorder or separation
yes.
anxiety. This is the adjustment disorder.
Adjustment.
Okay.
Yes, adjustment. Because new situation, new place, new job will cause adjustment disorder. Separation anxiety won't be having any new change of place or new job or anything else. Separation anxiety is mostly from person to person, like mom to kid or partners or parents, like this. Separation anxiety is with person to person, and adjustment is from places to jobs, etc. Okay. Anything else? We have covered mostly major spectrum for anxiety disorders today.
I
Just
have a question.
yes, Dr. Sumaya.
Like if the person says I have a problem with the closed spaces like lifts, elevators,
Yes, yes,
and the person say, "Your doctor, doctor, my office is in the fourth floor, and I have joint arthritis, and I can't go with the stairs, and I can't go to lifts. I am very fear of lifts, going to lifts. That in that case we will say that you switch your job, or you will say that I will talk to your manager to transfer. How will you counsel in that patient?
we will again go up. It's claustrophobic. Okay, so again, any kind of phobia will be treated firstly with the non-pharma CBT, then with the SSRIs. Still, he's not getting better. Along with that, we will involve occupational therapist. They might change the nature of the job or anything like that until his symptoms are resolved. So we don't have to treat the patient at the moment. Obviously, this will come under the specialist care always. You're not going to start even the SSRI. So you're just going to refer the patient, liaise him with the occupational therapist, and if he's having financial constraint, every time in psychological disorders, liaise with them social services. Financially, they should be stable. And the suicidal risk ideation, then a follow-up. That's all on the GP level. Okay?
Okay.
Hello,
Because
Dr.
occupational,
Matrat.
yeah, I guess, doctor.
I have one question. In last exam, there is a case. Some of them diagnose depression and some adjustment disorder. The patient
Yes.
have symptoms after he lost his job. Not his job. His wife uh, has a good job in another city. For that,
Mm-hmm.
he stop his job and go with his wife for two
Mm-hmm.
months. This is for 2 months. He develops symptoms after 2 months. He feel
Yes.
low mood and she feel he like a female sit with children at home and his wife go to work. This
Yes.
for you diagnose adjustment disorder or depression.
Okay, I'll tell you. In depression, the patient won't be enjoying his daily routines as he used to. Okay, low mood and also not in no interest in the daily routines as he used to enjoy before. Okay, but in adjustment, patient gets better off and on, and he
Mhm.
enjoys. But in adjustment, patient gets more tearful and low moods, along with the changes in mode of getting enjoyment with the kids or with going out. So these two things should be asked. Does he get better with anyone? And patient will be in normally in depressive patient in OSCE scenarios will always come with severe depression, and severe depression is never within 2 months. Okay, so severe or moderate depression will they will be looking down on the ground, not no eye contact, so no facial expression. But adjustment disorder patient will be interacting to you and will be giving normal information, and they wants to get better, and they know that in their ideas they might be telling you that it's maybe because of coming to this place not adjusting. Okay, so it
Mhm.
always depends on the whole case. And again, um, in the OSCE scenarios, they don't see your diagnosis at first. Okay, they see how holistic approach you have. So even sometimes you misconduct diagnosis, it doesn't matter. They will see how empathetic you are or how good you took the patient and how satisfied the patient is there for after your consultation. Okay, they
One more
they
thing.
they
Okay,
see a holistic approach.
One more thing, Dr. Musarrat.
thank you.
Can we say that at the end of the session, I would like to fill the PHQ-9 questionnaire so that I can identify the severity of your condition? Do we need to say this in the depression cases or like we just omit this line?
Some people prefer to say this, some people even go without it because PHQ-9 we should know it by heart. Like if it's more than 16 to 24, it's severe depression. It's 11 to 16, it's moderate. Less than 11, it's mild. So on PHQ, we usually know according to the physical pattern of the patient. But still, if you want to say, it's not a negative thing to say it. Like in on examination, you would say it that after at the end of the session, I might doing this scoring of PHQ-9 to know the severity of the symptoms. Okay, you can
Okay.
say it like that, and you can even add. I'm doing it just because it will help me into my management plan because there are difference between moderate and severe depression managements, right? That's why.
Okay. It's optional, no? Okay.
Yeah, it's optional. It's not necessary, but still some examiners like it, so we don't know who's sitting where, so depends. Okay, dear doctors. And if there is any query, we can discuss in the group. Thank you, everyone.
Tomorrow we will do, na?
Yeah,
Thank you so much. Tomorrow psychiatry will continue, na?
yeah, a few topics of its remaining.
Okay.
We'll
Tomorrow
continue
is
it. I'll be
mock,
sharing.
na? Mock also tomorrow.
Yeah,
Wednesday and
Tomorrow
Thursday.
is Wednesday and Thursday, so 2 days for the mocks. And who is there for mock? Are you available here? So everyone who is there for mock,
Yes.
please try to just, yes, review the cases once at least. And see you tomorrow. Best of luck and take care.
Thank you.
Thank you.
Thank you, doctor.
Thank you, doctor.